Hello, nice to meet you. My name is JeongHyun, who works at United Nations University at Macau. First of all, thank you for having me here. I'm looking forward to discussing many issues related to digital technologies and society through this seminar. What I bring today is how COVID-19 construct socio-technical subject, especially in South Korean cases. Here I bring the relatively new theoretical concept posthuman to describe our everyday experience to become normal citizens during the global virus situation. I do not discuss good or bad impact of digital technologies, and I do not argue that we are no longer human. Later, I discuss how we can reconceptualize our relationships with digital technologies when we imagine post-pandemic world. So this presentation will be focused on some case study of South Korean COVID-19 strategies to explain the concept of synthetic subject and post-human memory. So COVID-19. This is where we are. Without detailed explanation, we all know that the global society has been suffered by this unprecedented health crisis for more than a year. For the last year, we weren't able to travel, we weren't able to meet people, we weren't able to work normally. Even though COVID-19 is not the very first virus in the globe, but this virus transforms global society in many ways. There is the word called new normal, describing the new way of life that COVID-19 will bring out or already brought out. During COVID-19, each nation has a different strategy to compete the virus and keep the public health. For South Korea, they go digital. Since the first wave of the pandemic, the government forced to reduce unnecessary movement by conducting and encouraging online classes, working remotely, and online delivery. It was kind of global phenomenon. This online setting allowed people to have less face-to-face contact, which might cause virus infection between people. Another factor has been aggressive testing. The Korean headquarters of disease control traces back the detailed trajectory of people who got positive in the test and test all the people sharing the same place at the moment with the infected. I will discuss this part later, but the aggressive testing was possible because of digital technology being synthesized in human bodies. Thus, integrating mobile media and other digital technologies into every movement allowed have been major strategy to control the public health. Let me explain it through the three cases. The first example, since the early stage of COVID-19, the government and civil society has released the public health information such as National Testing Center, certified mask manufacturer, and the detailed trajectory of patients. Without moving around, people who have specific mobile applications can search where is the nearest testing center, how many infected comes up today, and where they go, and how many masks is left in the nearest manufacturer. Without connecting to this application, people should put themselves at risk by moving around the city to find the information. Being connected to this app means having higher possibility of being healthy during the pandemic in South Korea. The second example is mobile alert. The right image are national mobile alert that all citizens in South Korea must receive every day. The format has been changed as time goes by, but these mobile alerts are automatically show up in everyone's mobile phone to release health guidelines, the number of infected in one's county, and the link to the detailed trajectory of those who got positive at test. With 1 year-long pandemic, some people might not read all the details anymore. However, this is not a setting that let all people stay connected to the national control system. Third, starting from late 2020, when the quarantine is dismissed, people can visit almost all places by taking their phone at the front desk of the building. They need to provide personal information such as name, contact information, and sometimes gender and age that are registered in their mobile applications. So in case infectees are visited that place, the National Disease Control Center will have all the contact information of the people on the list at the same time or similar time period. So here are detailed process of epidemiological survey in South Korea. Let me summarize the process. If you see the first line here, when infection is detected, the headquarters gather their personal information upon permission of the National Police Agency. Then credit card company and mobile phone courier company provide their location and payment history. They often use CCTV footage to check whether they wear a mask or how long they stayed, those kind of information. On the second line, based on the trajectory provided by credit card company or mobile phone courier company, the center, the headquarters, clarifies the trajectory of infectee through many processes of confirmation. Some of the interview with the infectee and then other possible information they gather. Then in the last line, the center contact to the list of people who were in the same place at the moment to force them to test. When government makes sure of where they got infected and all those kind of epidemiological routes, they release all the information to the public and close the place for disease control. And this way, South Korea goes digital for the disease control very quick and easy. All three cases and this epidemiological process show that what they care is the combination of human bodies and their digital traces, which I called posthuman memory. In posthuman theory, it doesn't argue that we are no longer human, but that theory reconceives who we are as human beings in relation to other than human worlds. Subjects are always historical beings for posthumanist theory, which depends on material surrounding and technologies that are connected in the history. In maintaining well-being during COVID-19, the public health, the caring public health means caring one's posthuman memories. In the epidemiological survey, human was disassembled into data and digital traces and gathered, then reassembled back to the body with well-being or kind of infected body. So these examples are widely discussed in scholars who study surveillance. This is also an important topic for a long time we need to focus on. But here I would like to conceptualize becoming synthetic subject under the government who care one's posthuman memories. In the national prevention policy, we are always synthetic subject who are connected to many places and digital devices that we are inhabited. We've never been solely organic body to maintain the public health. We are always connected to mobile application, mobile alert, QR code, credit card, mobile phone, and other digital technology to maintain the normal life and stay in the national control system of the public health. Well-being is constructed by operations between organic bodies and our digital technologies, And even normal life is also constructed by operations between organic bodies and our digital technologies, which make us synthetic subject that is intertwined with technology that exteriorize our memory, movement, and health condition. These connections become our conditions of well-being during the pandemic. Without this connection, we cannot guarantee our conditions of well-being. We no longer believe anthropocentric care, but we care posthuman memories that are distributed in organic bodies and digital technologies. This might be creative solution of South Korea to compete the virus. After the pandemic, however, this solution will bring many issues like data security, data privacy, mode of work, and so on. United Nations is also considering the international organization for managing tremendous data worldwide. Now we need to examine what would be our creative solution to live in as synthetic subject. We need to explore the question of how, such as how we become synthetic subject, and how this synthetic subjectivation changes our way of life and so on. COVID-19 will change the worldwide landscape. We are calling it as digital transformation. People is worrying where we go with digital transformation. Even with artificial intelligence and all new emerging technologies, we are worrying in case humans are disappeared or competed by technologies. However, it is not technology versus human. We are already a synthetic subject who is intertwined with digital technology and surrounding material. COVID-19 just revealed it very apparently. Facing digital transformation, the synthetic subject and posthuman memory is my major suggestion to start when we imagining our relationship with digital technology in a post-pandemic world. Look around and see how you maintain your health and how you follow national control system or national control guideline through digital technology. There are digital technology connected to your body every time. I hope this presentation helped you to consider the new relationship with technology by moving away from one determine the other kinds of perspective. So this is the end of my presentation. Thank you for listening my presentation. So please feel free to contact me if you have any questions, comments, or shared interest. I hope everybody stays safe in the place where you are. Thank you.